Assalamualaikum and hi, Teacher Aishah here. So today I will be presenting on autism and Asperger's syndrome. Okay, first and foremostly, we will be going through what is autism. Okay, autism is known as a spectrum disorder because there is wide variation in the type and severity of symptoms people experience. Autism spectrum disorder or ASD is a neurological and developmental disorder that affects how people interact with others, communicate, learn, and behave. Autism is characterized by severe and complex impairments in reciprocal social interaction and communication skills, and by the presence of stereotypical behavior, interests, and activities. Okay, according to the Diagnostic and Statistical Manual of the Mental Disorders, DSM-5, people with ASD often have three symptoms, which is difficulty with communication and interaction with other people, such as making little or inconsistent eye contact, appearing not to look at or listen to people who are talking, not responding or being slow to respond to one's name or to other verbal bits for attention or other. The second is restricted interest and repetitive behaviors, such as repeating certain behaviors or having unusual behaviors, such as repeating words or phrases, having a lasting intense interest in specific topics, such as numbers, details, or facts or others. Lastly, symptoms that affect their ability to function in school, home, community, and other areas of life. It coexists with neuropsychiatric disorders, including seizures, attention deficit hyperactivity disorder (ADHD), affective disorders, anxiety disorders, obsessive compulsive disorders, and Tourette syndrome. Behavioral characteristics of autism categorized into four subclusters of disturbance, which are disturbance in social interaction, disturbance in communication, disturbance in behavior, and disturbance of sensory and perceptual processing and associated impairments. Okay, firstly, we will be going through disturbance in social interaction, which is autism can affect the child's ability to establish meaningful relationships with people and inanimate objects. Specific behavior observed are poor or deviant eye contact, failure to develop peer relationships, delayed or inappropriate facial expression, apparent aversion to physical contact, lack of social reciprocity, delayed or absent anticipatory response to being picked up, and lack of spontaneous seeking of another to share enjoyment, and apparent preference of being alone. While disturbance of sensory and perceptual processing and associated impairments was an abnormal response to visual, vestibular, and auditory stimuli. For example, children with autism appear to be overly sensitive to sound and may have difficulty coping with everyday environmental noises. Children with hypersensitivity, which can be undersensitivity or oversensitivity, are more likely to exhibit inflexible behaviors such as stereotypies and repetitive actions. Okay, the third subcluster's behavioral characteristic of autism was disturbance in communication, which is at the mild end of the continuum, normal language accompanied by slight articulation or tonal deficit observed, while at the severe end, complete lack of speech, which is mute. Okay, other types of speech and language problems were syntax problem, atonal and arithmetic speech, pronoun reversals, and lack of inflection and emotion during communication. Okay, other than that, communication problems are repetitive or echolalia. Okay, classic echolalia was parrot-like repetitions of phrases, immediately after the child has been exposed to them, while delayed or deferred echolalia was repetitions of phrases at a later time. An echolalic speech occurs out of social context and appears to have little or no communicative value. Okay, the fourth subcluster was disturbance in behavior. Intolerance of deviation from routine, resistance to any change, and patterns of behaviors such as stereotypical preservative lacking in representational or pretendly and desired attachment to unusual objects. Okay, for example, intense interest in a vacuum cleaner or a sheet of paper versus or which is other than stuffed animals or dolls. These patterns of behavior are obsessive from which any deviation is not tolerated. Deviation from the routine elicits intense temper tantrums, which is deviant motor patterns may involve the arms, hands, trunk, lower extremities, or entire body. Motor patterns in the upper extremities are common and include wiggling and flicking of the fingers, alternating flexion and extension of the fingers, and alternating pronation and supination of the forearm. Motility patterns are head rolling and bending, body rocking and swaying, lunging and darting movements, to walking, involuntary synergies of the head and proximal segment of the limbs, and inability to perform two motor acts at the same time. There are many types of treatments available. These treatments generally can be broken down into the following categories. Although some treatments involve more than one approach, the categories was behavioral approach, developmental approach, educational approach, social relational approach, pharmacological approach, and psychological approach. Okay, firstly, we will be going on behavioral approach, which is focused on changing behaviors by understanding what happened before and after the behavior. Okay, this approach has become widely accepted among educators and healthcare professionals and are used in many schools and treatment clinics. Okay, one of the popular behavioral approach was applied behavior analysis, which is encourage desired behaviors and discourage indesired behaviors to improve skills. Okay, two ABA teaching styles was discrete trial training and pivotal response training. Discrete trial training was step-by-step instructions to teach a desired behavior or response. Lessons are broken down into their simplest parts and desired answers and behaviors are rewarded. Undesired answers and behaviors are ignored. While pivotal response training was takes place in a natural setting than clinic setting, which is the goal is to improve a few pivotal skills that will help the person to learn many other skills. One example of a pivotal skill is to initiate communication with others. The second approach was developmental approach. Developmental approach focused on improving specific developmental skills such as language skills or physical skills, or a broader range of interconnected developmental abilities. Okay, developmental approach are often combined with behavioral approach. Okay, speech and language therapy helps to improve the child's understanding and use of speech and language. Some people with autism communicate verbally. Others may communicate through the use of signs, gestures, pictures, or an electronic communication device. Occupational therapy teach skills that help the person live as independently as possible. Skills may include dressing, eating, bathing, and relating to people. Okay, occupational therapy can also include sensory integration therapy and physical therapy. Sensory integration therapy will help improve response to sensory input that may be restrictive or overwhelming. While physical therapy helps improve physical skills such as fine movements of the fingers and larger movements of the trunk and body. Okay, the third approach was educational approach. Educational treatments are given in a classroom settings. Treatment and education of autistic and related communication handicapped children approach is based on the idea that people with autism thrive on consistency and visual learning. It provides teachers with ways to adjust the classroom structure and improve academic and other outcomes. For example, daily routines for this approach was daily routines can be written or drawn and placed in clear sight. Boundaries can be set around learning stations. Verbal instructions can be complemented with visual instructions or physical demonstration. Okay, the first approach was psychological approach, which is psychological approach focus on to cope with anxiety, depression, and other mental health issues. Cognitive behavior therapy focus on learning the connections between thoughts, feelings, and behaviors. Therapists and the individual work together to identify goals and then change how the person thinks about a situation to change how they react to the situation. Okay, the fifth approach was social relational approach. Focus on improving social skills and building emotional bond. Some social relationship approach involve parents or peer mentors. The developmental individual difference relationship-based model, also called flow time, encourage parents and therapists to follow the interests of the individual to expand opportunities for communication. One of the social relational approach was the relationship development intervention model, social stories, and social skills group. Okay. RDI model was activities that increase motivation, interest, and abilities to participate in shared social interactions, while social stories was a simple description of what to expect in a social situation, and social skills group opportunities for people with ASD to practice social skills in a structured environment. Okay, the last approach was pharmacological approach. There are no medications that can treat the core symptoms of ASD. Some medication treat co-occurring symptoms that can help people with ASD function better. Okay, for example, medication might help manage high energy levels, inability to focus, or self-harming behavior, such as head banging or hand biting, and help manage co-occurring psychological conditions such as anxiety or depression, and medical conditions such as seizures, sleep problems, or stomach or other gastrointestinal problems. It is important for this approach, it is important to work with a doctor who has experience in treating people with autism when considering the use of medication. This applies to both prescription medication and over-the-counter medication. Individuals, family, and doctors must work together to monitor progress and reactions to be sure that negative side effects of the medication do not outweigh the benefits. Okay, then let's going through in depth on Asperger's syndrome. Asperger's syndrome was a form of autism spectrum disorder. It's a developmental disorder. Young children with Asperger's syndrome have a difficult time relating to others socially, and their behavior and thinking patterns can be rigid and repetitive. Okay, Asperger's syndrome, severe and sustained impairments in social interaction and development of repetitive patterns of behavior, interests, and activities. Okay, people with Asperger's syndrome will show cognitive development and age-appropriate self-help skills or adaptive behavior aside from social interaction impairments. Although language skills are age-appropriate, individuals display idiosyncrasies in verbal communication characterized by highly circumstantial utterance, long-winded and tangential accounts of events, failure to convey a clear thought on one-sidedness. The such as obsessive interest in letters and numbers, absorbs most of the person's attention and energy. Okay, so people with Asperger's syndrome to display lack of nonverbal communication and of empathy, which is tend to intellectualize feelings and show a poor understanding of others' affect. So lastly, what is the difference between autism and Asperger's syndrome? Autism and Asperger's syndrome, both part of a wide range of neurodevelopmental conditions, share many similarities but also have distinct differences. Both conditions are characterized by difficulties in social interaction, nonverbal communication skills, and restricted patterns of behavior and interest. However, they diverge significantly in areas such as language development and cognitive skills. Okay, the difference between autism and Asperger's syndrome was autism is a mental condition present from early childhood, characterized by great difficulty in communicating and forming relationships with other people and in using language and abstract concepts. While Asperger's syndrome was developmental disorder related to autism and characterized by awkwardness in social interaction, pedantry in speech, and preoccupation with very narrow interests. Okay, autism indicates severe symptoms and signs, while Asperger's syndrome indicates very mild symptoms and signs compared to autism. But the symptoms was still the same with autism but mild one. Okay. Autism was usually preferred to stay isolated from the society, while children with Asperger's syndrome was highly preferred to move along with the society and interact. Okay, lastly, children with autism tend to have language delay or start talking later in life, while Asperger's syndrome display good language skills, although might use the language in different ways. Okay, so that's all from me on autism and Asperger's syndrome. Thank you for listening.